Well, also tonight, local CWA workers sounding the alarm, saying short staffing is putting worker and patient safety on the line. Earlier this week, the union filed more than 2,500 complaints against Catholic Health regarding staffing levels, citing the 2021 Clinical Staffing Committee law. This new batch of staffing complaints comes on the heels of thousands that were submitted by CWA District 1 in November against hospitals across the state, including Kaleida Health hospitals here in Buffalo. Joining us live tonight to go more in depth on this topic is Deborah Hayes, Area Director for CWA District 1. Deborah, thanks for taking time. It's always good to see you. And I first wonder if you can just sort of explain to us this Clinical Staffing Committee law and talk to us about why these violations that you found are so important.
So in 2021, New York required every acute care hospital in the state to develop a clinical staffing committee. The work of the committee was to sit down with their direct care workforce administration and the direct care workforce to develop staffing ratios for all of the direct care units, and then to turn those ratios into the state. Effective January 1st, 2022, those ratios needed to be followed on every day that a facility was open and caring for patients. The law also calls for complaints to be filed with New York State if in fact the ratios or other components of the law are not met. And that's what our complaints revolved around.
Deborah, I know you know this very well. The healthcare industry facing worker shortages like so many different industries out there. We did reach out to Catholic Health today to ask about these complaints. The company says they've hired more than 1,200 nurses over the past 2 years. And Catholic Health also writing, we'll show our viewers here, while we work hand in hand with the CWA to support our clinical staffing committees, the union staffing complaints go beyond Catholic Health and represent a more pressing concern. There are simply not enough nurses and clinical professionals in our community to fill all the job vacancies that exist across the region. What more do you feel needs to be done to address, I guess, what is really the underlying issue here, right? How do you recruit and retain enough nurses so that you don't have these violations?
I think that's a very good question, Michael. And the reality is that of the licensed registered nurses in New York State, only 53% of them are currently working as direct caregivers. And the problem is the hospitals are able to recruit people, and that's wonderful. But once folks start working in the conditions that they have to work under, they leave the bedside, and some leave the industry and the profession completely. So what we really need to do is focus on developing good healthcare jobs so that when people come into our facilities, they want to stay. And I do agree with Catholic Health that this is not just a Catholic Health issue, it's a Western New York issue, and it is a statewide issue. We need to get more people at the bedside, and if we can improve our staffing levels, then there are more people that would be willing to enter the profession or come back to the bedside and provide care.
Absolutely. This is something that impacts everyone watching right now, whether we are sometimes in the hospital or loved ones. We appreciate you taking the time.
Right.
Deborah Hayes, Area Director for CWA District 1. Great to see you. Thank you.
Thank you, Michael.